If you or someone you love struggles with high blood pressure, what I'm about to share could completely change how you see your health. Not someday, not years from now, but starting in the next few weeks. Because today I'm going to reveal 4 natural supplements that research shows can lower blood pressure almost as effectively as prescription medications. And not just a little, we're talking about real measurable drops that doctors pay attention to. But before you get excited and rush to the supplement store, you need to hear this carefully. These supplements only work when they're used the right way, the right dose, the right timing, and the right combination. Used incorrectly, they can do absolutely nothing. And in some cases, they can actually be dangerous. So please listen closely because I'm going to explain everything step by step in simple language. No medical jargon, no confusion. Just clear, practical guidance designed especially for adults over 50. And before we continue, if you care about protecting your heart, your brain, and your long-term independence, take 1 second right now to subscribe to Healthy Aging. This channel is dedicated to helping you stay strong, sharp, and healthy as you age, using evidence-based information you can actually trust. Subscribing helps you stay 1 step ahead of health problems instead of reacting to them later. Now let me ask you something important. Are you currently taking any supplements for blood pressure? Just think about that for a moment. Magnesium, garlic, vitamin D, CoQ10, even one of them. Many people already are and they don't even realize it. And that's exactly why this conversation matters, because supplements are not automatically safe just because they're natural. Natural does not mean harmless. Natural does not mean you can mix anything, anytime, in any amount. I want to tell you a true story that explains this better than anything else. Edward was 69 years old. Like many people his age, he had been managing high blood pressure for several years. He was taking 2 prescription medications, and his readings were usually around 130/82. Not perfect, but acceptable. Edward started reading online about natural ways to lower blood pressure. He liked the idea of supporting his body instead of constantly increasing medications. So he went to a health food store and bought 4 supplements he had seen mentioned again and again: magnesium, CoQ10, potassium, and garlic extract. All of them have research behind them. All of them can help blood pressure. But Edward didn't know the correct doses. He didn't know the timing. And most importantly, he didn't know how dangerous it could be to stack supplements on top of prescription medications without monitoring. So he followed the instructions on the bottles. He started taking all 4 supplements at the same time, while continuing his prescription blood pressure drugs. Within just a few days, Edward started feeling off. Dizzy when standing up. Weak. Lightheaded. His wife noticed he seemed confused and unsteady. On the 5th day, Edward stood up from his chair and nearly collapsed. His wife caught him just in time. She checked his blood pressure. It was 88/52. That's dangerously low. They rushed to the emergency room. When the doctor asked Edward what he was taking, Edward listed his prescriptions. Then the doctor asked, "Are you taking any supplements?" Edward mentioned the 4 supplements. The doctor's expression immediately changed. He explained that Edward wasn't just taking 2 blood pressure treatments anymore. He was essentially taking 6 prescription medications plus 4 supplements that also lower blood pressure. His pressure dropped too fast and too far. He was at serious risk of fainting, falling, hitting his head, or even triggering a stroke. Edward was told to stop all supplements immediately. Within 2 days, his blood pressure returned to normal. Edward was shaken and angry because no one had ever told him that supplements require the same respect and precision as medications. And this is why I'm being so careful with this information. Supplements can be powerful tools, but power always comes with responsibility. Now let me ask you something else. Are you currently taking both blood pressure medication and supplements at the same time? If you are, you need to hear every word of what follows, because when supplements are used correctly with the right plan, the results can be remarkable. Research shows that specific supplements lower blood pressure through completely different pathways than medications. Instead of forcing numbers down, they support blood vessel function, reduce stiffness, improve nitric oxide production, and correct underlying deficiencies that many older adults don't even know they have. Now I'm going to walk you through the 4 supplements, starting with the least powerful and building up to the most effective one. The 4th supplement is vitamin D. Most people think of vitamin D only in terms of bones, but low vitamin D levels are strongly linked to high blood pressure. Studies consistently show that people with low vitamin D tend to have higher systolic readings. When vitamin D deficiency is corrected, blood pressure often drops by several points. But here's the critical detail most people miss. Vitamin D cannot work properly without magnesium. Your body literally cannot activate vitamin D unless magnesium is present. That's why so many people take vitamin D for years and see no improvement in blood pressure. The vitamin isn't the problem, the missing magnesium is. Which brings us to the 3rd supplement. Magnesium is the foundation. Magnesium helps blood vessels relax. It reduces resistance inside the arteries. It improves the lining of the blood vessels so they respond better to pressure changes. And magnesium is involved in hundreds of reactions that directly affect heart health. The problem is that most older adults are deficient. Diet alone rarely provides enough. Absorption decreases with age. Stress drains magnesium. And many common medications deplete it even further. Low magnesium quietly raises blood pressure in millions of people. When magnesium levels are restored, blood pressure often begins to fall naturally, not overnight, but steadily. Now the 2nd supplement is CoQ10. CoQ10 is a compound your body naturally produces, but production drops sharply with age. By the time you reach your late 60s or 70s, your body may be producing half of what it once did. CoQ10 is essential for energy production inside heart cells. Without enough of it, the heart has to work harder, and blood pressure often rises. Research shows CoQ10 supplementation can significantly lower blood pressure. In some studies, the effect is comparable to adding a medication. And here's something very important. If you're taking a statin medication for cholesterol, those drugs block the same pathway your body uses to make CoQ10. That means statins can worsen CoQ10 deficiency. This is why many people on statins experience muscle pain, fatigue, and stubborn blood pressure that won't respond well to treatment. Now, before I reveal the most powerful supplement, I want to pause for a moment. If this information already feels helpful, please like this video and share it with someone you care about. High blood pressure affects families, not just individuals. Sharing this could genuinely help someone avoid another medication or prevent serious complications. And stay with me, because the final supplement is the one that often makes the biggest difference. And now, let's talk about the supplement that consistently shows the strongest impact on blood pressure in older adults when used correctly. This is not raw garlic, not garlic powder, not garlic capsules that leave you smelling like a restaurant kitchen. This is aged garlic extract. Aged garlic extract is garlic that has been aged for months under controlled conditions. This process removes the harsh sulfur compounds that irritate the stomach and cause bad breath, while concentrating the compounds that support blood vessel health. And the research on aged garlic extract is impressive. Multiple clinical studies show that aged garlic extract can lower systolic blood pressure by 8 to 12 points on average. In people with uncontrolled hypertension, the reductions can be even greater. Why does it work so well? Because aged garlic extract increases nitric oxide production. Nitric oxide helps blood vessels relax and widen. It reduces stiffness in the arteries, which is one of the main reasons blood pressure rises with age. It also has mild ACE inhibitor effects, similar to some prescription blood pressure medications, but through a gentler mechanism. This combination makes aged garlic extract one of the most effective natural tools we've studied for blood pressure support. But here's the part you need to hear carefully. Just like Edward's story showed earlier, aged garlic extract must be used responsibly. Dose matters, timing matters, and combining it with medications requires monitoring. So now I'm going to give you the complete protocol, exactly what to take, how much, when to take it, and how to combine everything safely. Listen carefully, and if needed, come back and replay this section later. Aged garlic extract should be taken in a dose between 600 and 1200 milligrams per day. The form matters. Look specifically for aged garlic extract, not standard garlic supplements. Research has consistently used this aged form. It's best taken with food to avoid digestive discomfort. You can take the full dose once daily or split it into two smaller doses, one with breakfast and one with dinner. Most people begin seeing noticeable changes in blood pressure within 8 to 12 weeks. Now let's put all four supplements together in a clear and realistic way. Magnesium should be taken daily in the range of 400 to 500 milligrams. Choose a well-absorbed form like magnesium glycinate or magnesium citrate. Avoid magnesium oxide, which absorbs poorly. Magnesium is best taken in the evening, about 1 to 2 hours before bed. It supports relaxation and sleep, which also helps blood pressure regulation. Vitamin D should be taken as vitamin D3, not D2. A typical dose for older adults is 4,000 to 5,000 IU per day. It should be taken with a meal that contains fat for proper absorption. Remember, vitamin D only works properly when magnesium levels are adequate. CoQ10 should be taken in a dose of 100 to 200 milligrams daily. If you're over 60, the ubiquinol form is better absorbed. CoQ10 is fat-soluble, so take it with a meal that contains healthy fats, usually breakfast or lunch, and aged garlic extract, as mentioned, should be taken with food, starting at a lower dose and increasing gradually. When these four supplements are combined correctly, research suggests average reductions of 15 to 20 points systolic and 8 to 12 points diastolic over several weeks. That's not a promise, it's an average. Individual results vary, but these are real numbers supported by studies. Now, this is critical. If you are currently taking blood pressure medication, do not start all four supplements at once. Doing that is exactly how Edward ended up in the emergency room. Instead, supplements should be introduced gradually, one at a time, while monitoring blood pressure closely. A safe approach looks like this. Start with magnesium alone for the first week at a lower dose. Monitor your blood pressure in the morning and evening. If your readings remain stable, increase magnesium to the full dose in week 2. In week 3, add vitamin D while continuing magnesium. In week 4, add CoQ10 at the lower dose. In week 5, increase CoQ10 if tolerated. In week 6, add aged garlic extract at the lower dose. Only after several weeks of stability should the garlic dose be increased. This slow approach allows you and your doctor to see how each supplement affects your blood pressure and adjust medications if needed. Because here's the truth. As supplements begin to work, your medication doses may become too strong. That's not a failure. That's success. But it requires supervision. Now let me share a story that shows what happens when this is done correctly. Dorothy was 68 years old. Her blood pressure averaged around 152/88, even while taking 2 medications. Her doctor suggested adding a third drug. Dorothy asked if she could try a natural approach first. Her doctor was skeptical but agreed to give her 3 months. Dorothy followed the supplement protocol exactly. She added each supplement slowly, monitored her blood pressure twice daily, and kept her doctor informed. After 8 weeks, her readings dropped to around 138/78. After 12 weeks, her average was 132/76. That's a 16-point systolic reduction without adding another medication. Her doctor was impressed. Instead of adding a third drug, they reduced one of her existing medications by half. Dorothy felt better, more energy, fewer side effects, better control than she'd had in years. Now compare that to Frank. Frank heard supplements could help. He bought the cheapest brands he could find, took them inconsistently, didn't monitor his blood pressure, didn't tell his doctor. After 2 months, nothing changed. Frank concluded supplements don't work. But the problem wasn't supplements. The problem was how they were used. Wrong forms, wrong doses, no consistency, no monitoring. This is why details matter. Now let me answer some of the most common questions people ask. If you're not on blood pressure medication yet, these supplements may help delay or avoid the need for medication, especially if your readings are only mildly elevated. But if your systolic pressure is consistently above 160, medical evaluation is essential. These supplements work while you take them. If you stop, blood pressure usually rises again over time. Think of them like medications. They manage the problem but don't cure it. Brand quality matters. Cheap supplements often use poorly absorbed forms. That's why results vary so much between people. And yes, supplements can interact with medications. Always tell your doctor and pharmacist what you're taking. Now let's talk expectations. In the first couple of weeks, you may not notice dramatic changes. That's normal. By weeks 3 to 4, small reductions often appear. By weeks 6 to 8, many people see significant improvement. By 12 weeks, most people reach the maximum benefit. If after 12 weeks there's little improvement, underlying issues like kidney disease, sleep apnea, or vascular disease may need to be addressed. Before we finish, I want you to engage with me in the comments. Tell me which supplement you're most interested in starting. Magnesium, garlic, vitamin D, CoQ10, or none yet. Also comment your goal. Are you hoping to lower your numbers by 10 points? Avoid medications? Reduce your current dose? Your comments help this channel reach more people who need this information. And if you found this helpful, please share it. High blood pressure silently damages hearts, brains, and kidneys every day. Sharing this could genuinely help someone you care about. Subscribe to Healthy Aging for clear, evidence-based guidance designed for real life, not hype. In the next video, I'll reveal a very common vitamin that many older adults take every day, believing it's helping them, when research shows it may actually raise blood pressure. You won't want to miss that. Thank you for staying with me to the end. If you watch this entire video, you now have the knowledge to approach natural blood pressure support safely, intelligently, and responsibly. Take care of your health, monitor your numbers, work with your doctor, and I'll see you in the next video. Research shows CoQ10 supplementation can significantly lower blood pressure. In some studies, the effect is comparable to adding a medication. And here's something very important. If you're taking a statin medication for cholesterol, those drugs block the same pathway your body uses to make CoQ10. That means statins can worsen CoQ10 deficiency. This is why many people on statins experience muscle pain, fatigue, and stubborn blood pressure that won't respond well to treatment. Now, before I reveal the most powerful supplement, I want to pause for a moment. If this information already feels helpful, please like this video and share it with someone you care about. High blood pressure affects families, not just individuals. Sharing this could genuinely help someone avoid another medication or prevent serious complications. And stay with me, because the final supplement is the one that often makes the biggest difference.